will enable jobs for New Zealanders.
Question number 11, Kevin Hague. Point of order, Honourable
Mr. Speaker, I should have sought leave to table a document after the end of my question.
Let's check what the document is.
The document is the review document from the Nelson Marlborough District Health Board entitled The Future of General Surgical Orthopaedic Service Delivery for Wairoa Hospital. No, it's not.
Then
I don't think many people have got it at all.
I allow them. Let's see whether the House. Is there any objection to that document being tabled? No, there is not. The document may be tabled. Question number 11, Kevin Hague.
Thank you, Mr. Speaker. My question is to the Minister of Health and asks, is he satisfied with District Health Board's performance against his targets for the health sector?
Mr. Speaker.
Honourable Joe Goodhue.
On behalf of the Minister of Health, overall yes, but we can always do better.
Kevin Hague.
Supplementary, Mr. Speaker. Why hasn't he made unexpected hospital readmissions a national health target when these are internationally recognised as the standard measure of overall hospital service performance?
Honourable Joe Goodhue.
Mr. Speaker, on behalf of the Minister, under the previous government there were a plethora of targets. This government has chosen to have just 6 targets, and those 6 targets are the concentration of DHBs and are reported on. So instead of some 42 targets under the previous government, we have narrowed down the targets, and we believe that those 6 targets represent a start. However, the member raises a good point, because there are always other things we can be working on, and pathways and integrating care certainly goes to the heart of the suggestion that the member has made.
Supplementary question.
Actually a point of order, Mr. Speaker. Mr. Speaker, I seek leave to table a graph showing readmission rates rising sharply. The graph is actually from the Ministry of Health, but it's sourced here from a document from the Association of Medical
I'll allow leave to be put. Is any objection to that graph being tabled? There is not, and may be so tabled.
Thank you, Mr. Speaker.
Kevin Hague, supplementary question.
What evidence does he have for his assertion that senior doctors are wrong when they say part of the reason that unexpected hospital readmission rates are increasing is because New Zealand has the second highest rate of emigration by medical specialists?
Honourable Joe Goodhue.
Mr. Speaker, what I am able to answer on behalf of the member is that we now have 1,000 more doctors working in our hospitals around New Zealand. I believe that the member is quoting from an ASMS report that has been released quite recently, timed to coincide with their negotiations over salaries.
Point of order, Mr. Speaker. I seek leave to table data that shows only 141 more senior medical specialists.
And the source of that document?
It is from the ASMS report that the Association...
Leave is sought to table that document. Is there any objection? Appears to be none. Further supplementaries?
Well, no, another point of order, Mr. Speaker.
Point of order, Kevin Hague.
I seek leave to table research showing New Zealand needs an additional 285 senior medical officers.
And the source of the document?
Is from that same document, sir.
How many more documents are you seeking to table from the same document?
No, that will be it, sir.
That would be it. Let's put leave. Leave is sought to table. There is objection.
Mr. Speaker, supplementary.
Supplementary question, Kevin Hague.
Isn't he concerned that unexpected hospital readmission rates are increasing, especially for Māori and Pacifica people, because money and resources are instead going to the areas that he has incentivised through his narrow health targets?
Honourable Joe Goodhue.
On behalf of the Minister, I actually refute the member's assertion. Whilst DHB increases in funding are across the board under this government, while there has been a priority to put additional funding into health and primary care in terms of children getting free visits after hours, children's getting free visits to their doctors, I could actually provide for the member a huge list of additional funding
Order.
to actually address healthcare issues.
Supplementary question, Kevin Hague.
No, it's a point of order, Mr. Speaker.
Point of order,
I
Kevin
seek
Hague.
leave to table the findings of a new study published in the International Journal of Quality in Healthcare that Māori had 16% higher odds of readmission or death compared
Leave
to
is
European
sought
New
to table
Zealanders.
that new research document. Is there any objection? Appears to be none. I move to question number 12 in the name of the Honourable Phil Goff.
Mr. Speaker, my question's to the Minister of Defence. Does he